Aloha. Aloha kakahia kakako. And I haoli makahiki ho. Happy New Year to everyone. Mahalo for joining us and welcome to Hawaii Care Choices Healthcare Talk Story. And a beautiful happy hump day Wednesday. I'm Tish Lopez, your moderator this morning. And with me is my wonderful co-host who you all know and love, Lonnie Weigert.
Aloha, everyone.
Just as a friendly reminder, today's talk story is being recorded so that you and others can access it in the future. All of our presentations are available on our YouTube channel simply by searching Hawaii Care Choices. We are also on Facebook, Instagram, and Twitter. So please follow us, get all the latest updates, our exciting events that are coming up, get to know our staff, and so much more. Also, say aloha to Lani and myself. For those of you that are joining us on Zoom, the bottom of your screen should look like this. Please follow that green arrow and click on the chat box, say aloha, and let us know where you are joining in from. For those of you that are joining in on Facebook Live, aloha. Mahalo for joining us. Use your comment box to say aloha to all of us and where you are joining in from. We love to see the comments, the hearts, thumbs up, and definitely share this live video recording where to anyone that you feel will need this information. All right, friends. So late last year, we launched our Empower Your Choice Talk Story series. And this year, we continue the conversation and explore the understanding of health equity and how that impacts your access to quality care. So during the webinar, you can ask as many questions as you want. Use that chat box or go ahead and use that Q&A box as well. Friends, I'm so excited to introduce our guest speaker today, Dr. Sulma Gandhi. She has joined the Stupski Foundation in 2021, where she leads partnerships in Hawaii focused on the critical areas of maximizing early brain development and improving serious illness care. Soma's passion is building diverse, equitable, and inclusive communities for a thriving Hawaii. For over 25 years, she has worked in the fields of health, human service, and education with both community-based and government organizations across the state. Soma is a Reiki master and holds a master's and bachelor's degree in science and a doctorate degree in business with a focus in healthcare management and leadership. She is also certified as a leadership coach through the International Coaching Federation. Soma serves on the Hawaii Suicide Prevention Task Force, Safe Spaces Safe Spaces and Workplace Initiative, and the Early Childhood Action Strategy. Of special note, she is the recipient of the Chamber of Commerce Athena Award, which recognizes women's contribution and leadership in business and community service, and is a Omidyar Fellow through the Hawaii Leadership Forum. In 2023, Soma was honored by the Association for Fundraising Professionals for Outstanding Community Leadership by the Pacific Business News as one of Hawaii's most admired leaders. Without further ado, please give me a warm round of applause for Dr. Sulma Gandhi. Aloha, Soma, and congratulations on this wonderful award.
Mahalo.
Three.
I am so honored to be here and to join you in conversation today.
We are so honored to have you. And I would love to start if you could please elaborate more on your current position and what is the Stupski Foundation?
Oh, sure. So the Stupski Foundation, a couple of years ago, I learned about the Stupski Foundation for the first time and had never heard of the foundation, even though I've been living on the east side of Hawaii Island for about 25 years now and have supported and worked at different nonprofits, both in the healthcare, human service, and in education. Just had never heard of the Stupski Foundation. And then when I learned, Joyce and Larry Stupski, the founders of the foundation, had actually been supporting and partnering and caring for their two beloved communities, which is the Bay Area and Hawaii, for decades, for many, many years. They were in great partnership and continue to be with the Hawaii Community Foundation. And that is how they had resourced and supported in many different ways. In the around 2015 or so, the foundation made the decision that by 2029, we will shut our doors. So I am working in an organization that cares very deeply about these two beloved communities, and who also believe that the dollars, the endowment, do not need to stay with the foundation. They need to be in the hands of the wise leaders of these communities who know best of what is needed for those that they're serving. And so I'm on that journey, and I feel very blessed to be on that journey with the foundation to lead our work in early brain development and in serious illness care.
That is so wonderful. I so appreciate you kind of just giving us an overview of the foundation. And we'll go ahead and rewind. Share with us how you started this work with improving health outcomes for the seriously ill.
My background in education is as a healthcare administrator, and I've worked in the fields, as I was mentioning, in child abuse and neglect, domestic violence. And then when Hawaii Care Choices was initially called Hospice of Hilo, I was blessed to have that opportunity. And at such a young, earlier time in my career, to have that kind of impact of working and the experience, like I got so many more gifts from that experience of working with those that are transitioning, with the family, the caregivers, and the staff who cared so deeply for their communities. And it taught me a lot about, when you're working in death and dying, it teaches you a lot about life and how you want to live life, and what kind of decisions you would like to make, and some of the challenges that happen during those transition times. So that's a little bit of how I started. I fell into a lot of these areas primarily because of these were the needs of the communities, these were opportunities in the communities, and worked in that intervention, and then led into a little bit into the education part, which, we'll talk about how important education and outreach is for the work that you're doing at Hawaii Care Choices as well. I think another lens that I have lived to learn, that many of our local communities live and learn, is what it's like living on a rural and remote island. And so there's other factors involved there in terms of access and resources and workforce, and how we can care for one another in those ways that can circumvent some of those obstacles. And then there's also a lot of abundance when you are on an island that tends to, which I feel very proudly about, we tend to partner well, we tend to support one another across different organizations. And this tends to be an environment where I have felt like it's been a yes, and yes, we can do that. And how can I help, and how can I partner? And that's across organizations. It's been an incredible journey.
I love that you share that, and I love that you share about this education, because we've been doing Talk Story for these 3 years. I'm going to hand it over to Lonnie to ask a question, but the education is so important in letting our community know what's available. Lonnie, you have a question for Dr. Sulma?
Oh, of course. And thank you so much, Tish, for bringing us into the new year. And Soma, I think it's so appropriate that we're talking about our journeys today and starting the year off that way. And also, I love your part about, early in your career, you started with Hospice of Hilo, and you were able then to continue to evolve those gifts out in the community and across Hawaii and beyond. And I think that that's what I see as one of the sustainable gifts that we have, is when we have somebody that does join us and is working on our mission, and then they go because things change and they have other opportunities, etc. They go and they take that in their heart with them, and that is the true gift that keeps giving. And here you are, so back with
Full
us,
circle,
even
yeah.
Even if it's only for an hour, I mean, we feel so blessed that, your all of your expanded experiences are now with you as a vessel, and you're able to share that. So, speaking of journeys, tell us a little bit about what you did on your holiday journey just
Oh,
recently.
yeah.
Yes, share
Uh,
with us so that we can kind of understand like where you are coming back into the new year.
yeah. Um, Before I do that, what's coming up for me when you ask that question is one of the experiences I had at hospice, which I appreciated so early in my career, is the multidisciplinary, integrated way of holistically um, caring for and considering the person living with serious illness, the family
Yeah.
members that are surrounding, and the community that's surrounding, that's being impacted as well by that transition or that experience. And I have that having that knowledge and that lived part of how an organization can work that way is really how we experience life, isn't it? We don't experience life in a silo, that it's just the clinical, medical, physical part. We also experience the emotional, we experience all of these other factors that are involved. So I just came back with my family from Aotearoa, from New Zealand, and it was the first time I've been there. And I felt like my son said to me, I have 16-year-old twin sons, and one of them said to me within the first 24 hours we were there, it's like every decision that they make here is based on sustainability, on the environment, not just like the environment of the land, the aina, the vai, it's also about the people. And he was already noticing that sense of holistic well-being that permeates throughout all of the experiences that we had as a tourist. Even on a daily basis, we were there for 2 weeks. I heard somehow, as a tourist, I'm not even there working in the healthcare field, the word hospice, some information around hospice. I heard palliative care. There was just tons of public health types of messaging around mammograms and colonoscopies and just all of these things that were completely around the well-being and taking care of one another and supporting one another. The pictures that I saw that were up around towns, some towns, were of healthy bonding relationships of fathers and a baby. Those are the kinds of experiences, and it gives a message, and it shows not only the community that's living there, because they're not doing that for the tourists, they're not trying to advertise this is who we are, they're doing it for each other. So I appreciated that. I just it just I'm still processing. I'm not very articulate about it. I need to go back, I need to learn more. And I think it was a beautiful model of what could be possible in rural remote, because they have a population of about 4 to 5 million people. We're about at 1.5 million. Surely there are things that we can continue to do towards that path for outreach, education, and being able to destigmatize and talk about some of these hard topics that are all a part of life, right? So,
That is so great to hear you share that with us, because it's kind of like looking in the past and then having so much optimism for the future, and that there they go, the other, our cousins down over there at Aotearoa. I mean, that is a beautiful thing, because I thought when I visited there that they were very um with regard to the care of their culture and their people, and that was first and foremost, like
mhm.
everything. And we were truly just tourists coming along, like it was just so amazing. And I talk about that because of the well-being that it clearly grounds itself in that community, which
Mm,
then brings me back to our discussions with our communities here, because in your work with Stepski, can you tell me, like, what has your experience been with regard to the efforts made on trying to support and help create pathways for the seriously ill to access that care now.
Well, I'll talk about we support both the Bay Area and Hawaii, and I'll talk a little bit around what some of the things that we are doing here in Hawaii around palliative care. And so I'm wondering, would it be helpful to talk a little bit more about what palliative care is? There is still so much confusion around
Oh,
what is hospice, what is hospice to begin with, and then what is palliative care in comparison. And so maybe we level set on that a little bit. I'm
yes, yes.
curious
Please.
I'm curious how Hawaii Care Choices defines and describes, because you're the main providers for Hawaii Island on these two areas.
Well, I'm glad that you bring that up because it is something that we need to repeat again and again and again. And for those who have a serious illness, and I just like to come out with a story so that people really understand like what happens. Like for someone that is living with a serious illness, say cancer, um, in the past, prior to even knowing about palliative care, people would go and have treatments. And with those treatments came some really debilitating symptoms. And so there really wasn't any support or care for that. You just accept that that's how it's going to be. You're going to suffer and suffer, and that's your quality of life will diminish over time to the point where you're probably depressed, etc. Anyway, a wonderful thing called palliative care was created where it's specialized care where we actually focus on boosting the quality of life and reducing the discomfort from the symptoms that are caused by the treatments. So we had somebody that was on Talk Story who I just have to share part of her journey with us. But when she was just 21, she a newlywed, and she was also going to school to become a doctor. She wasn't feeling well. She went in and she was diagnosed with cervical cancer. Anyway, her lifestyle was one that was very active. So she, she loved to be in marathons. She was a cyclist, etc. And when she went in and she got that just shocking diagnosis, what happens is when the person hears the cancer word, they don't actually hear anything else after that. I mean, they are just terrified, and the fear that comes through. I mean, the psychosocial thing that's happening with them is just really huge. Besides the fact that she was a newlywed too, so she was just trying to navigate all of that. Anyway, her doctor says, which is really what the doctors do, because they're always looking for a cure. So her doctor says to her, you know what, we're going to schedule you for surgery next week. We'll just cut this out. You're going to be good to go and don't have to worry about anything. So, okay, so we'll go ahead and schedule it. Okay, so she's walking in the hall with her newlywed husband, thinking to herself, like, I'm gonna go under the knife now. I mean, like that's what the options were. No other discussion now. I'm talking about she's probably spent maybe 15 minutes with her doctor. And so she's not feeling right about it. She's going to school. She knows that there's probably other options, but she doesn't know what it is. And she happens to come across a palliative care social worker in the hospital as she's leaving. And as God is our shepherd, she happened to come across this woman who then she asked, this is my situation, and um can you share with me if you think that this is a right option for me? And the first thing that she was asked is, can you tell me what your life goals are? It had nothing to do with medical. It was just, what's important to you in your life? She says, well, I'm a newlywed. I would like to have a baby. I'm an avid athlete. I love going and doing marathons. And so she says, okay, all right, so let's start working from there. And then it was discovered that surgery was not the best option for her, that had she continued to go forward with that, not only would she probably not have a child, but she was definitely not going to be a cyclist after that. These discussions are discussions that really hit to the heart again and again and again. And she was on Talk Story here, sharing it with us. And she ended up taking some other options. She was able to have a child. She was able to continue and be a cyclist. And further to that, her belief in palliative care was so strong that she now advocates for the state through MedQuest. And that is our wonderful Tori Fields that did that for us. So it is true. It's actually something that does happen. And she was just so floored at the idea of how much money people are spending, but they don't realize that there are these other options available for them, how much discomfort they have by going through, treatments that maybe is not the best for them, but no one has asked them about their dreams and wishes. And so with palliative care, it then puts the palliative team on the team with the physician, and now we can serve the whole person. And that, my friend, is the beauty of palliative care. And so, yes, I mean, as you can tell, we're quite passionate about it, but it's because we have seen it so many times. And that if we can save even one from having to go down that road, it is so worth it. And now that we have the opportunity not only to teach many of the physicians, because you're absolutely right, many do not know what palliative care is. I mean, they view it as it's end of life. It is a subset to that degree, but really, palliative care is about boosting the quality of life. We need to get right in there and help them with the symptoms of their treatments, and really make life so much better for them. So what has happened with us being out and doing our outreach, we've been able to bring really hundreds of people on to the service, and give them that hope that their quality of life is still very much intact, and that with some support we're able to allow them to really live a quality life, for not just 2 weeks or a month. I mean, they could go on for years, and that therein is the gift of palliative care. So that's my gig on it.
Thank you. And what I'm hearing from that as well, and what we've experienced, is that how you define quality of life, Lonnie, might be very different than how I define quality of life. So that social worker's question was vital on
Yeah.
what is it that you want, what are your life goals, what are your dreams and your wishes, and then are the possibilities and options are wide and varied and can be infinite in ways that are diversified per individual.
Yeah.
And that takes advocacy. It takes the support of your caregivers around you to and yourself to somehow, like when you said that, when you get the cancer diagnosis, you go into, like, there's all this fear and there's all these other emotions that come up, that it's difficult to ask the questions, to know which questions to ask. You're dealing with all of these other emotional parts and not necessarily seeing or having access to the bigger picture. And it's a crisis. It's in a crisis moment that, you're at being advised through clinical guidelines to get a surgery next week, because then you'll have more options if this happens. And so there's a crunch timeline, and those are the experiences that people go through. And how do we soften that? How do we come with that, with more of that holistic perspective that hospice offers? And palliative care does not mean that you have a prognosis of end of life. Palliative care is pain and symptom management for ease, for quality of life. And there's so much that I am grateful for, that this has entered in for us in a way that I know we hadn't been talking about 20 plus years ago when I was working at Hawaii Care Choices, and that this is now more of an expanded field and there's more knowledge and education that's happening around it.
It is. So it's wonderful. So, how did Stepsy come across deciding that that was going to be, a place that
So
they wanted to support?
Larry Stupski, our founder,
Yes.
he also experienced a serious illness, and he
Okay.
passed from that serious illness. It became, and with all of the resources, and they were in a different community, living in a different community with access to different medical resources than we have here, for instance, on Hawaii Island, it was still hard and it was still challenging.
Mhm.
And it became a mission and a will and a wish that the experience of those that are living with serious illness can have a different kind of experience than what they had seen around them and what they might have experienced themselves. So that's part of the, the heart passion that
Yeah.
came
Yeah.
for the why.
Yeah.
And in Hawaii, one of the things you mentioned, the work with MedQuest, is that we have been in partnership with MedQuest and many of our local organizations, including Hawaii Care Choices,
Okay.
to bring on to opportunity with our MedQuest beneficiaries to have access to home-based palliative care, which is different, and it's expanded. And then that is to help with supporting and giving additional resources to those families that are at home and who could benefit from palliative care. It is new. It isn't quite on the books, and what we know about legislation, laws, and benefits and plans is just because it's written on paper doesn't mean we can actually implement it. We need the workforce, we need organizations that are educated to be able to actually implement it. And that's why we're also partnering with Hawaii Care Choices and Hospice Maui to help build up those programs and those initiatives so that it can be utilized for our communities.
That's so great because, inequity has been something that we've been really challenged with quite a bit, particularly in the rural areas, largely because a lot of the people that live out there, they not only are they not aware that it's even available, but that, it makes difficult access for them too when the physicians and providers are not really clear what palliative care is. So I'm really proud of our leadership who has actually come across a program called Acclivity that will help our physicians and clinics identify the people that need the help so that we can just get right to them and let them know. Because we and you probably know this too. I mean, if you go to a lot of the doctors' offices, there's just thousands of um files of health files. So the fact that someone's going to be going through and just double checking, like, oh, maybe Mrs. Souza needs it, I mean, that's just not going to happen. But when we get a tool such as Acclivity that can go through electronically and find the people that need the help, and we can get them the help early enough, because
Right.
that was really what one of the challenges are for us even to this day. There's, one of the challenges was that the providers didn't understand what palliative care was. Another one was access, and then another one was nobody was offering it to them. They weren't, that this is where the inequity is. And I just wanted to kind of ask you, because you have the vision of not only here in Hawaii, but beyond the reef, where you can see what's happening on the Bay Area side. Like how has that affected people, who either are going to be covered under insurance, or because they have no idea, they're ending up spending more money to get that access. So, well, what has been your experience?
Well, we have other types of characteristics, I think, on in Hawaii. And some of that has to do with our beautiful, diverse cultural diversity, right? And
Yeah.
so there are and cultural, different languages and cultures that we have to be able to bridge to be able to even do the outreach and the education. So, that's a factor. And that's a factor when you also have a provider shortage who is very
Yeah.
busy. So
That's
our
so
docs are
real.
busy. They're having not enough time. There's translators that are needed. It's like the one of the most important roles are community health workers, because they're really the types that are the bridges for being able to translate, not even just in language, but from a culture and from a heart-centric, how you were talking about how a social worker can do that
Yeah.
in ways that can be the bridge to different kinds of palliative care, which is just like another clinical word, right? So what does that really mean?
Yes.
And
Yes.
how is it that we're going to bridge that? And I'm thinking about stories of, we just had like this big storm that came through, right?
Yeah.
That it seems a little blown over Hilo right now, but we saw all on the news all of the water that's rushing in different locations. And we have people that are living in places that, the water starts running down the road. There is no access to them for any kind of home-based kind of care, or they can't access and get out, right? So there's so many other kinds of disparities and challenges that happen because of our particular location and the ways that we have chosen to or are able to live, that are positive, and then also make it difficult for that access. With the benefit, our hope is that then there's more people who and Medicaid is for those that are underinsured or not that that need additional support for medical care and access in ways that maybe their employer might not be able to provide, or that they just don't have it. And so that is the way for equity to happen.
Yeah.
I know MedQuest is also working on potential partnerships with other organizations that are focused on provider education and also community education throughout the state. So those are ways, and I think pathways for more information to come out, and for us to figure out how to destigmatize and make this conversation normalize before the crisis happens.
Yeah. Yeah. I think that's excellent. And that there's people like yourself that's out there, trying to get the infrastructure set up so we can start moving to it. Because you're absolutely right. When I go out and I talk to the community, nobody knows what palliative care means, nor do they care, because like what is those words mean to me? So I really put it from the perspective of you know solving their problems, providing them better solutions on things such as chronic pain, or just nausea and other types of symptoms that they get because they're going to treatments and they had no idea that there was even any support or care. They just figured, I mean, that's just how it
Way of
goes.
life.
Yeah.
This is how I know. This is the way of
Yes.
life. This is what quality of life is, and you get used
Yes.
to it, right?
So as I go out to the community and I speak to them, some of them are actually angered that they weren't told. Particularly the caregivers will say, "What do you mean? My husband's been suffering with that for so long." And I said, "Well, these are the gifts that I have for you today. Number one, you're here, so now you know. And number two, this is the phone number you call so that we can get that help on its way." So it's it's wonderful when I go and I speak to a group and then I ask, how many of your physicians or providers, how many of them have told you about palliative care? In the crowd, maybe two people raise their hand. I'm so optimistic by that. I'm like, oh my God, somebody has heard about it. And then I ask, oh, please tell us who your primary physician is. And then they'll say, Dr. Dolan. I know. So The reason, of course, we're both laughing is because, of course, Dr. Dolan is part of the inner circle and she's really driving that ship, quite a bit. What differences do you see from the Bay Area side of how they are approaching palliative care?
We've focused here primarily on the palliative care, and in the Bay Area, it's a little bit broader in the serious illness care realm. There has been focus on that outreach and education as well. But we've here with the type of resources we've had, we've gone as much as we can in with supporting that this MedQuest benefit hopefully will get onto the books and that we can actually implement it in the short timeline that we have with the foundation, because like
Yeah.
as I shared, we're closing our doors, so it's important to focus in that way. I can share another, this discussion started with about talking about inequity, and I can share another thing that we're doing. It's not necessarily centered on serious illness, but it's around a concept of moving and shifting power from funder, for
Yeah.
instance, to a nonprofit, but then how do we even shift that down to families?
Mhm.
So we are going to, in the next couple of years, have some experiments around what is called in the philanthropic world participatory grant making, where families are making and involved in the decision making on how resources are utilized for their community. And that focus area is not in the serious illness, it's in our early brain development focus area. But it's for Keiki and families, and it will be happening on Hawaii Island as well. So, there's different things that we're experimenting with on by closing our doors and saying it doesn't make sense for us to hold on to dollars, an organization, a foundation to hold on to dollars and shift that out. So we need to close our doors for
Yeah.
that. That's a philosophy. That's a strong philosophy to
Yeah.
hold. And it's really around justice. And this is another form of a how to transform the decision making and keep moving it as much as we can closer to the organization and to those that benefit from whatever is needed and those meeting the needs for the community.
Wow, that is a great bridge coming into dealing with inequity. That's a beautiful thing. Do you see other communities across the state that are starting to embrace palliative care? Like, I don't know, Kauai or on Oahu, anybody?
Well, definitely on Maui.
Yeah.
I think you have a staff member who's very well connected to Kauai as well. So,
Yeah, yeah, yeah.
I think it's one of those things that's happening and slowly happening. And, once there is, from an organization perspective, and if there's reimbursements that can come in
Yeah,
through
yeah.
West, I think that's going to also open up a door, because the way healthcare is set up in the US is as a business, as an entrepreneur, that you have to figure out how to make the costs work in a certain way. So I'm hopeful from some of those ways that's also happening. I know that there is going to be, I'm hoping, and I believe that this is going to happen. There's going to be quite a bit of outreach, as I mentioned, with a couple of our partner organizations,
Yeah.
Ripohala and Kokuamau. I also wanted to just shout out Community First.
Yeah.
The first time I did an advanced healthcare directive was when I was decades ago at Hospice Hawaii Care Choices, and this is what we were talking about, and we had access to doing it. So I did it very early in my married life, in my career, and that was the first one I did. I also changed it a number of times as my life shifted, because what I knew then, or what was important to me then, shifted as the years went on, even though my values might have remained the same. And Community First did, they do these, well, it was during COVID, I think, is when I did it, redid it. They did something on Zoom. I had access to it, redid the forms. Both my partner and I redid ours, and then we just did a drive-by, got it signed by them, and it's done. And then what happened, when every time we renew that, we have the conversation around death and dying, and if there is a crisis, and if there's a medical diagnosis. And that's so important to keep having that conversation going. And how do we model that for our children so that
I
they're
know.
doing it as well, and that they're not having, the anxiety and fear when mom or dad are diagnosed, if they're diagnosed with a serious illness.
That is really that's really great that you did that, and also that you continue to put efforts into updating it because a lot of times, people just think, oh, I mean, that's like years from now. I don't have to worry about it, but it's wonderful to work on that now. And the fact that you mentioned about, passing on information to our kids so that they don't have to deal with the fear and the anxiety of, I mean, what do we do like when mom gets sick? Because my daughter has pointedly asked me too, like, just let us know right now. I mean, we're all good. Let us know now instead of, okay, wait, now what are we gonna do? And because she sees too in the work that I do that people wait way too long. There's a lot of suffering in that waiting too, and it's all kinds of things that make people wait. Some feel that it might hasten the condition of their loved one if they go and call for help, because then now they're actually accepting that there's something very serious going on. But I think that's very wise that we talk to our families about it too, so that they can understand that it's actually just life, like they don't have to fear from it. But I'm seeing that we're just a little past the halfway point. I just want to check in with Tish. Tish, is there any questions that um you'd like to put in at this point? Because you know that I have a whole list of questions for Sulma, so I don't want to be just a hog with her the entire time. But Tish, do you have anything or any comments you'd like to share from her? Because I see that people are coming in on the chat quite a bit.
Absolutely. Well, first, talking about Community First and the Advanced Healthcare Directive, we have a message from Nick. He says, Aloha all. The Community First Advanced Healthcare Directive program that Dr. Gandhi mentioned is still going on. Next class is January 21st at the ADRC in Hilo at 2 p.m. So there also is a link. Thank you so much, Nick, for also being a wonderful co-host for us. Because we discussed, a lot of people who may have gotten theirs, update it. If it's been years, please,
Mhm.
take a look and update that. So thank you so much. And just wonderful comments. No questions right now. I'll save the comments for right at the end. So go ahead, Lani, with your questions.
Okay, great. Thank you. Thank you so much, Tish. And thank you, Nick. I'm glad, Soma, that you brought that up about Community First, because we're such a fan club of theirs, because they do help quite a few of our patients and communities who maybe didn't have a chance to do their advanced health care directive. And it's just really wonderful that we have them as a resource. So I wanted to ask too, in your experience, um, do you work very often or speak much with the providers or the physicians regarding, offering or providing palliative care? I mean, on our side, we know that many of them don't know how to talk about palliative care, and it's largely because, they don't talk about the goals of care. And then, because that will obviously open it up. But what has been your experience in the last, I'd say, just since the pandemic? What kind of feedback are you getting from, or interest that you're getting from our providers regarding palliative care?
So this is more observational because I
Yeah,
don't
yeah.
interact with providers in the way Hawaii Care Choices does, right? As direct service providers. And so this is more observational. And I have to also keep reminding us that on Hawaii Island and throughout actually our state, we have a shortage of providers, of physician providers. And so they are so stretched. and they're doing the best they can, and they're seeing more people than they can even possibly manage to see. And so that also shortens down the quality of the time and the interaction to be able to, for an individual like me, to be able to process this, receiving a diagnosis of a serious illness, and then being able to coherently ask certain questions that I would have to lead versus, it being more of a joint way. So these are just a few observations. One is that I do think that our provider group there's still confusion between palliative care and hospice. You've both mentioned that earlier in our conversation. You're noticing that as well. And so there needs to be some form of way to be able to distinguish the two, that palliative care does not mean you are, as people might, giving up on life.
Yeah.
And actually, hospice is not giving up on life either. It's just that you still can go through interventions that are meant for curative ways with palliative care. And palliative care does not necessarily mean you need to have a specific diagnosis of 6 months or less, or all of these things that connect with hospice. So palliative, it's its own entity. There is a small intersection with palliative and hospice, but palliative is not hospice. And I think that is something that not only are we trying to talk about right now, but that's something that needs to, I wish, happen more in the education field for our medical providers. So it also, in the typical medical school curriculum, until recently, there have been many seasoned providers. They may have not been accustomed to those types of approaches to care without having that reasonable training to understand those different kinds of approaches to care. That is now happening more recently. So some of this has to do with medical training. It has to do with updated training, all of those things. No physician would want to make a referral to a service that doesn't exist, or there's a big wait list on, or that there's a shortage around, right? So we have those workforce shortages. And so there's a thing around, we want to talk about it, but what is our ethical duty to keep talking about it if we cannot provide for it, right? And that's something that Hawaii Care Choices is concerned about, is saying, we're talking about it, and we need to be able to responsibly, if we say we can offer the service, be able to offer that service and have the staff and have the trained staff, palliative trained staff, to be able to do it, which is what you're working on, is to keep bolstering and upgrading and training the workforce and other nurses on these clinical ways of being and practices, so that whether they stay, like me, whether I stay with hospice or not, or Hawaii Care Choices or not, it still will travel with them in their service and their care for others in our communities. I'm thinking those are the few observations I have. We believe palliative care is important and is a critical part of the healthcare continuum and healing process, which is both the physical, which tends to be often what our PCPs, providers, or specialty care providers focus on, but it's also part of the emotional. And that's why I love the holistic. There's so much everyone can learn from the original holistic part of the theory around hospice and how to do hospice from, initially from decades and decades and decades ago, of how hospice is done in that integrated fashion. Palliative is done in that integrated fashion. And they're in all of our areas in healthcare. We can learn from that type of model.
It's so great that you bring that up about the holistic approach with hospice, because, we're just total diehard hospice people. So when palliative care came in, we had to take cracks and lickings with, no, this is palliative care now. Because we want to immediately go in there and just love on everyone from the hospice perspective, which is like the Cadillac of all services, it's like, so we're really quite grateful to have evolved to a point where no, these are our palliative care patients, and this is what we're providing for them. Talk to me about what you have seen along your journey with how they're integrating the memory care into palliative care now. How have you? What has your experience been, and how they're using that in palliative care now?
So you're talking, I learned the term memory care, I think probably from Hawaii Care Choices
Oh,
more recently. So I would love for you to share a little bit about how you're seeing that integration happening. And let's talk about that because I'm happy to reflect and respond to what
well,
you're
it's
noticing.
well, it's really interesting. And you know what? We have our friend on here, Nick, who we work quite closely with him regarding Alzheimer's and dementia care. But we're adding on to our list of diagnosis with palliative care, uh, the those who are living with dementia or Alzheimer, and it's very interesting on how we identify when they're ready to or when we're able to provide them, that support and service. And it was kind of elusive, in the beginning, like, okay, so how do we actually do that now? Like, what are they showing that shows a difference, that we're, oh wait, that's a change. Like, let's just say, Auntie reads the newspaper every single day. All of a sudden one day she doesn't she doesn't want to read it anymore, or she only reads one page instead of, from front to back. Like, you start to just notice that they're not doing something, and I mean, and it's so incremental. And Nick, I don't know if you want to offer any comment. Go ahead and put in the chat. But um I'm just saying, from that perspective, it's it's been a need that we definitely need to provide, but it's been a little elusive,
Yeah.
on, okay, like, okay, this is definite, this person needs the help, but that's not how memory care works. So
Well, it's also not how those, my understanding of the disease processes also work for Alzheimer's and dementia. It's very individualized in terms
yeah,
of our how we experience our symptoms. And if you experience it, it will likely be very different than how I would experience it. And so the behavior changes that are noticed also likely will be coming from the surrounding caregivers, if there
yes,
are caregivers that are aware and noticing and are not juggling 50,000 other things that are probably in their own lives.
yeah, yeah,
I'm trying to support. And so that's part of what I'm glad that dementia and Alzheimer's and the memory care is being integrated. It's important. It's going to be one of those learning curves that is probably going to take a couple of decades to go through as we have an aging population as well, and we get more experience as organizations and providers in that field.
yeah, I agree. Tish, was there any comment that you wanted to share?
There is no other comments, but we have 5 more minutes. Oh, hold on. Nick just sent in palliative care for individuals living with dementia is challenging because of how wide the spectrum of needs can be from the early stages through the end stages. Absolutely, what we were talking about. Palliative care focuses on the quality of life and not just the medical intervention. So he is excited to see how it goes. Thank you so much, Nick, for your input. Uh,
Thank you, my friend. Thank you. It's important, we had Tipa Snow on Talk Story with us, Soma, and you know the information, the education that they gave us, those are just such special gems that we are able to share with caregivers, because we really want the quality of life for the caregiver, as well as the patient, to continue to thrive as we go on. But if you don't realize what's going on with your loved one, I mean, it can turn really negative quite quickly, and then it becomes frustrating for everyone. So, you know, I was just interested in hearing what you have observed on your journey along the way with regard to how palliative care is fitting in um, with with all of our memory care patients.
I am glad you keep bringing up the caregiving part, and I just want to make the compassionate, I guess, just another noticing and observation, because I work in the both sides of the spectrum
Yeah,
of that
yeah.
life of our life cycle, right? With the early brain and then also in serious illness. And both of those are buffered by caregivers, whether it's a caregiver for a young one or a caregiver for our kupuna. And the kinds of support and the outreach and the
No,
well-being of those caregivers is vital. It's a role that, you know, as moms that juggle, we don't get. It's just like it's the thing you also have to do with everything else that we want to do and get to do. But it's an add-on to all of these other things that you're juggling. And so my wish is also, as I continue in this field, is to see a shift in the kind of support and the value that we give to our caregivers, because none of this can
even
happen
happen without them.
without that strength of those caregivers and
Yeah.
that's
I'm so glad that you kind of, brought that forward as with the caregivers, because as we talked earlier, it's the holistic approach, especially at Hawaii Care Choices, what we do. We don't only look at the patients, but the families as a whole as well. So I just want to say thank you so, so much for your time and just your mana'o here this morning. I have a special message from Brenda, our CEO, who is listening in this morning. She says, Aloha and mahalo, Soma, for sharing with us your time, expertise, and experiences. We are honored to have you on our talk story. We have another special note from our Director of Advancement, Lori Jordan, who I'm sure you've worked with before. She said, we are honored and exceedingly grateful to be a part of the Stupski Foundation, spend down, and vision to collectively promote well being and abundance for everyone. It is refreshing that Stupski is so community rooted. Thank you for trusting us. East Hawaii is definitely better because of our friendship, our partnership. Mahalo. Oh,
well,
and Nick is also saying mahalo for sharing your experiences, Dr. Gandhi.
thank you, Brenda, Lori, and Nick. I appreciate it. It's been lovely to spend time with you, Tish and Lonnie.
It has been
Thank you.
so great. We have about 1 minute. So, is there any last words that you'd like to say to our listeners today?
Yeah, two pieces. My wish for the future and my wish for the now, which I think we can do, is um, have the hard conversations now before a crisis happens. And you can do that through advanced healthcare directives. You can do it just by having the conversation and have them repeatedly. And the other is, and this is from personal experience and things that I've observed, is when um, you are hit with a crisis or you're receiving some information, it's really important to have somebody else, whether it's a caregiver or a friend or somebody else in the room with you, because you might be processing the emotions, and you can have somebody else who might be able to gather the information, hear it in a different way that is a little bit less centered on that heart part, and can help you navigate through. So those are the two things that we can easily all do, and I think would make a big difference in how we can access care.
Absolutely. That is beautiful. Thank you so much for sharing those wishes with us. Folks listening, I hope we strive to also do that. For friends that are on Facebook, please send your thumbs up, your hearts. If you enjoyed this presentation, mahalo for also joining in with us. Everyone is invited to next month's Fully Engaged Zoom presentation on February 12th at 10 o'clock. So our 10th is on a Saturday, but we'll see you right back on February 12th at 10. Be on the lookout for the registration link on our Instagram and Facebook, or you can visit our website, hawaiicarechoices.org/healthcare talk story to catch us live. Friends, I also just want to say Soma did give me a small link to our Stupski Foundation. So I'm going to go ahead and put that in the chat. You all have a few minutes and want to go ahead and see more of this amazing work that this foundation is doing, both in Hawaii Island, but then also in the Bay Area as well. Please go ahead and check that out. But I would like to say thank you again so much, Soma. Thank you, Lani, for your time. Mahalo, everyone, for joining us. See you next month on Healthcare Talk Story. Ahui ho, malama pono. Take care.
Aloha.
Aloha.